A lot of people are concerned about the health impacts of air quality, but they don't have a good sense on how big of an issue it might be for their communities. And so we're glad that we can provide this report and provide information that local communities can understand these important impacts. There's thousands of excess deaths occurring each year that would be avoided, tens of thousands of emergency department visits and hospital admissions be avoided, right down the list to a number of important health outcomes that would be prevented if we were to take more protective action to improve air quality. Now, that's what we've included for the last several years. This year, with funding from the Environmental Defense Fund, we're able to add in a new health outcome, which is adverse birth effects, including both preterm birth and low birth weight. We want to make sure there's enough scientific evidence that supports a finding there's a clear causal relationship between outdoor air pollution and an adverse health effect. And we feel like in the case of adverse birth outcomes, that the scientific evidence is now sufficient to allow us to make these estimates. With some supplemental funding from NASA, we were able to the very first time look at health impacts specifically from pollution from wildland fires. And you can see in the Western US, in the Midwest, and the Southeast US, there are a large number of unmonitored counties that have important health relevant concentrations of pollution from wildland fires the community should be aware of and trying to think about ways to address those health risks from that important emission source. They can use this report, they can use these numbers, and they can argue for strong action no matter what EPA does at the federal level. And we really think that's a real value of this Health of the Air report.